Okay, so this is the fourth and final recording of the blood vessels chapter, and this will actually be a short recording as a lot of this will be found in the lab aspect. So the largest artery in the body is the aorta. This begins at the left ventricle, and there are four subdivisions. You have the ascending aorta. This is the initial segment that travels superiorly. Recall that the right and left coronary arteries that supply the myocardium will actually branch off of the ascending aorta. And then this will be curved to become the aortic arch. The first branch is the brachiocephalic artery, or the brachiocephalic trunk. This will quickly branch into the right common carotid artery and right subclavian artery to supply the right side of the head and neck with the common carotid, or supply the right upper limb and thorax with the right subclavian. Now remember, the heart is on the left side of the body. So the left common carotid will come directly off the left ventricle there, and the left subclavian will directly come off the aorta. The left common carotid and left subclavian will directly come off the aorta. What the brachiocephalic trunk is doing is it's sort of bringing you over to the right side, and then you're branching to the right common carotid and right subclavian. So the common carotids will supply the head and neck. The subclavian will supply the lower limb. The aortic arch will then turn inferiorly to become the descending thoracic aorta. This travels through the mediastinum posterior to the heart and branches into supply the thoracic structures. The descending thoracic aorta enters into the abdominal pelvic cavity to become the descending abdominal aorta. At about the level of the fourth lumbar vertebra, this will split into terminal branches called the right and left common iliac arteries. These arteries split into internal iliac arteries, which will supply the pelvic structures, and external iliac arteries, which will supply the lower limbs. So here we can see coming off, we have our brachiocephalic trunk right here, right common carotid, right common carotid, right subclavian. Then we have our left common carotid, left subclavian. You can see the thoracic aorta, and then we have the abdominal aorta. Here's a split into the iliacs right here. As far as identification purposes are concerned, any artery that's sort of listed on this diagram here, you should be aware of and know. So arteries that supply the head and neck, you have the common carotid arteries will split into two branches at about the level of the fourth cervical vertebrae. You'll have the external carotid, which will supply the superficial structures of the head and face, the internal carotid, which will supply the brain, and the carotid sinus. This is located in the common carotid artery and the initial segment of the internal carotid artery. And the carotid sinus is where you'll find a lot of those receptors. So here we can see the carotid coming up. We have our internal carotid, which will go straight up into the brain, external carotid, most superficial structures. Majority of the brain supply comes from two internal carotid arteries, which will branch into the skull, into the anterior middle cerebral arteries, and the ophthalmic arteries. A cerebral vascular accident
found.
This is damage to the brain, which is caused by a disruption to its blood flow. The fourth most common cause of death in the United States, and there are two main causes of cerebral vascular accidents: blockage of one of the brain's arteries due to a clot, or loss of blood due to hemorrhaging. Common symptoms for a CVA often affect one side of the body, occasionally occur in both sides of the body when multiple clots break off and block several vessels downstream. You oftentimes will see sudden onset paralysis, loss of vision, difficulty speaking or understanding speech, and a headache. Risk factors for CVAs include hypertension, atherosclerosis, diabetes, cigarette smoking, hypercholesteremia, cardiac dysrhythmias called atrial fibrillations, which we talked about in the prior chapter. The risk of CVAs increases with age, and women have a higher lifetime risk of CVAs than men do. Treatment for CVAs due to ischemia generally include medications to dissolve the clot and thin the blood. TPA is something that's used within the first several hours. Hemorrhagic strokes usually require surgery to repair the damaged blood vessel. Regardless of the cause, prompt treatment is necessary, as any delay in treatment can result in permanent neurological damage, and depending on the severity of the stroke, this can even result in death. So here you can see the arteries of the thorax. We're coming down. This is the thoracic aorta here. And you can see branches coming off that can supply most of the thoracic cage there. And then we have our abdominal aorta, and we can see the split to the iliacs here. Coming off the abdominal aorta, you have the phrenic artery, which will supply the diaphragm, the celiac trunk, the suprarenal artery, mesenteric artery. The celiac trunk will supply the stomach, renal artery, kidneys, mesenteric artery, intestines, gonadal artery, testes or ovaries, and then also the mesenteric artery again. Let's see. Here you can see the mesenterics. Upper limb, we have the subclavian. Subclavian is going to branch into the brachial artery, which will then branch into the radial and ulnar arteries. In the leg, you have the abdominal aorta, which is going to branch into the common iliac, and remember that that's going to branch into the internal and external iliacs, which will supply either the pelvic or the lower limb there. Pulse points, these are areas where you can actually detect a pulse: temporal, carotid, brachial, radial, ulnar, femoral, popliteal, and then down in the foot there. Okay. And again, here's a list of all of the major arteries, systemic arteries in the body. These are the ones that you should know. If you did see any questions on the test, multiple choice or true and false, probably, the artery and what it supplies would be what you'd want to know. Okay, and same thing goes for the veins. There's a similar table right there for the veins. Very similar names, structures of that they are draining as the arteries are supplying. Okay. So again, these two tables, these are the list of structures that you should know. Okay. And these are just looking at the images of the various veins there. Again, you'll be working on a lot of those through your lab side of things. All right, and this is it for blood vessels. The next chapter is lymphatic and immune. Talk to you later, guys.